In the fall of 2010, just felt my neck for some reason, and there was a lump there that hadn't been there before. The surgeon that removed that lymph node, he did a biopsy to follow up, and he couldn't find anything, so he sent me to a radiation oncologist. He said I'd need 6 or 7 weeks of radiation. I went to an oncologist locally. Of course, he begged me to come to Iowa City for a second opinion. And I said, well, if I do this radiation and chemo, what are my chances? He said 50-50. I said, 50-50? He said, well, what did you think I was going to say? I said, 100%. Chemo and radiation should be able to take care of that. Well, I thought 50%, I'm going to get that second opinion. And I came here.
So Mr. Wray was referred to us with a diagnosis of metastatic squamous cell carcinoma to his neck. The surgical management of cancer in the oropharynx, which is where the tonsil and tongue base live, has historically been an open operation. It requires splitting the lip, making an incision in the neck, splitting the jawbone, and essentially moving the jawbone out of the way to get back there. Oftentimes you then have a hole that you have to fill with tissue from somewhere else. That's called a flap.
He said, I'm going to use a robot so I can be more precise. And boy, that really sounded good to me.
TORS stands for Transoral Robotic Surgery, and it allows us to use not only the surgeon's hands but the assistant's hands. So it's actually a 4-handed operation, 2 robotic hands, 2 hands from the assistant.
I was so confident in Dr. Bayon, his visits with him, that I never really was too worried.
I guess what I would want people to know about transoral robotic surgery is that it provides a good alternative for select patients to get a good surgical oncologic outcome and potentially avoid some of the toxicities of radiation and chemotherapy.
Feel great. Got to see my granddaughter born and 2 grandsons, 5 and 6, sign up for BMX racing, all those other things that a person likes to see.